What is bone TB? Understanding this tuberculosis form. Imagine a disease that can quietly spread from your lungs to other parts of your body, causing long-term damage if not caught early. That's what happens with bone tuberculosis, a rare but serious form of tuberculosis. It starts when the bacteria responsible for tuberculosis, called Mycobacterium tuberculosis, travel through the bloodstream or lymphatic system from an initial infection site, often the lungs or lymph nodes, to infect bones or joints. Because it affects areas outside the lungs, it is known as an extrapulmonary form of tuberculosis. Bone tuberculosis most commonly targets the spine, which is also called spinal tuberculosis or Pott's disease. It can also affect weight-bearing joints like the hips and knees, but it is capable of infecting any bone or joint in the body. The bacteria tend to settle in parts of the bones that have rich blood supply, such as the middle of long bones or the vertebrae. Over time, this infection can cause destruction of bone tissue, leading to deformities if not treated properly. Symptoms of bone tuberculosis develop gradually, making early detection challenging. People often experience persistent and severe pain in the affected bone or joint. Swelling and tenderness around the area are common, and stiffness can make movement difficult. As the infection progresses, bones or joints may become deformed and muscles near the infected site can waste away. In cases involving the spine, symptoms might include back pain, and in more severe situations, neurological issues like muscle weakness, paralysis, or spinal deformities such as a hunchback can occur. Many individuals with bone tuberculosis also have symptoms of active tuberculosis elsewhere in the body. These systemic signs include feeling very tired or weak, having fever and night sweats, losing weight unexpectedly, and losing their appetite. If someone has active lung tuberculosis at the same time, these symptoms often appear together. Diagnosing bone tuberculosis involves a combination of clinical assessment and laboratory tests. Doctors will review symptoms and medical history, then use imaging tools like X-rays, CT scans, or MRI to look for bone damage or abnormalities. Laboratory tests such as bacterial cultures, polymerase chain reaction tests to detect tuberculosis DNA, and biopsies of bone tissue are essential to confirm the presence of Mycobacterium tuberculosis. Treating bone tuberculosis is a serious process that requires patience and careful management. It usually involves a long course of multiple antibiotics, specifically designed to target tuberculosis bacteria, often lasting several months. In some cases, surgery might be needed to drain abscesses or stabilize damaged bones. Early diagnosis and treatment are vital because, if left untreated, bone tuberculosis can cause permanent damage, deformities, or neurological problems. If you experience persistent pain, swelling, or stiffness in your bones or joints, especially if you also have symptoms like fever or weight loss, it's important to see a healthcare professional promptly. Remember, each person's experience with tuberculosis can vary, and personalized medical advice is essential. Early detection and proper treatment can help prevent serious complications and preserve mobility and quality of life. In summary, bone tuberculosis is a form of tuberculosis that spreads beyond the lungs to infect bones and joints. It causes chronic pain, swelling, and sometimes deformities, and it needs careful diagnosis and a long-term treatment plan to manage effectively. Always consult healthcare providers for personalized care and follow established medical guidelines for the best outcomes.